Okie dokie. So today I wanted to get off the topic of DID and talk about another personality disorder. Histrionic personality disorder. It's kind of like someone who's a hypochondriac who wants everything but doesn't actually have that illness. So, histrionic personality disorder is sort of like that, except it's an actual disorder. So, yeah. The symptoms of histrionic personality disorder are uncomfortable unless they are the center of attention. They dress provocatively and or exhibit inappropriately seductive or flirtatious behavior. There's rapid emotion shifts. They act very dramatically as though performing before an audience, exaggerated emotions and expressions which appear to lack sincerity. They're overly concerned with physical appearance. They constantly seek reassurance or approval. They're very gullible and easily influenced by others. Excessively sensitive to criticism or disapproval. Low tolerance for frustration and be easily bored by routine. Beginning projects without finishing them, possibly skipping from one event to another. They do not think before acting. They make rash decisions. Blah, 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 blah. Self-centered and rarely show concern for others. Have difficulty maintaining relationships. Often seems fake or shallow in their dealings with others, and they threaten or attempt suicide to get attention. Those are the symptoms of histrionic personality disorder. As for the causes of histrionic personality disorder, they're not really known. Many mental health care professionals believe that it may be caused by learned and inherited factors. For example, tendency factors may run in families, which suggests that genetic susceptibility for this disorder might be inherited. However, the child of a parent with this disorder might be repeating learned behavior. Environmental factors that are a possibility are lack of criticism or punishment as a child, positive reinforcement that is given only when the child completes certain tasks or certain approved behaviors, along with unpredictable attention given to the child by their parent or parents. All leads confusion about what types of behavior earn parental approval. Personality disorders also usually develop in relation to an individual temperament and psychological styles and ways people learn to cope with stress while growing up. Now, the treatment for histrionic personality disorder, they don't believe they need treatment or therapy. They also tend to exaggerate their feelings, dislike routine, which makes treatment difficult. They might seek help if depression or other problems caused by their actions causes them distress. Might. Treatment includes psychotherapy or one-on-one sessions. Goal of treatment is to help individual uncover motivations and fears associated with his or her behavior. Another goal is to help person learn to relate to others in a more positive way. Sometimes, medication might be used as treatment for other conditions that might also be present with this disorder, such as anxiety and depression. And that is histrionic personality disorder. Why I am talking about that? The little inner committee has decided that it would be the best if I talk about that. Why, I don't know. They also want me to talk about dissociative disorders, which I wrote down, and I did bring my little notebook with me. So let's talk about dissociative disorders as well. Dissociative disorders may include memory loss, amnesia, or certain periods, events, people, and personal information. Not all dissociative disorders actually include amnesia, but dissociative identity disorder does. A sense of being detached from yourself and your emotions. A perception of the people and things around you as distorted and unreal. A blurred sense of identity. Significant stress or problems in your relationships, works, or other important areas of your life. Now remember, we're talking about dissociative disorders now, not histrionic personality disorder. Another symptom of dissociative disorders is inability to cope well with emotional or professional stress, mental health problems such as depression, anxiety, and suicidal thoughts and behaviors. Causes of dissociative disorders. These disorders usually develop as a way to cope with trauma. They most often form in children subjected to long-term physical, sexual, or emotional abuse, or, not as common, a home environment that's frightening or highly unpredictable. Stress of war or natural disasters also can bring on dissociative disorders. Personal identity is still forming during childhood, so a child is more able than an adult to step outside them. Oh, that's a thorn. Ow! Sorry. Personal identity is still forming during childhood, so a child is more able than an adult to step outside themselves and observe trauma as though it's happening to a different person. A child who learns to dissociate in order to endure a traumatic experience may use this as a coping skill or a coping mechanism in response to stressful situations throughout life. Now, the treatment of dissociative disorders may vary based on type of disorder you have, generally include psychotherapy and medication. Psychotherapy, primary treatment for dissociative disorders. This is a form of therapy, aka talk therapy, counseling, psychosocial therapy, which involves talking about your disorder and related issues with a mental health professional. Look for a therapist with advanced training or experience in working with people who have experienced trauma. Therapists will work to help you understand the cause of your condition and to form new ways of coping with stressful circumstances. Over time, therapists may help you talk more about the trauma you experienced, generally only when you have the coping skills and relationship with your therapist to safely have these conversations. Okay, and the medications, there's no specific medications, actually no medications whatsoever, that specifically treat this disorder. The doctor may prescribe antidepressants, anti-anxiety, or antipsychotic drugs to help control mental health symptoms associated with dissociative disorders. But there is no specific medications that actually help dissociative disorders. So, that's why psychotherapy is the primary treatment. Okay, I talked about both histrionic and dissociative disorders, and histrionic personality disorder. Because the intercommittee thought it would be a good idea. By intercommittee, I mean the possible alters I have in my head, which I introduced in the last video. So, yeah. The intercommittee decided it would be best. As to why, I still don't know. They're not telling me. I don't particularly care to know, but I thought a little education would be a good idea. So did they. So, signing out. Bye.